Don't panic if your cholesterol is elevated. Look at the total lipid panel and not just one number. The goal isn't to lower a number, it is to create a healthy internal environment where cholesterol can do its job safely. When you get your blood results, you will usually see total cholesterol, triglycerides, LDL, and HDL. Now, total cholesterol alone is not enough to understand your risk. You need to look at the full picture, each number and how they relate. The key numbers to check are: number one, triglycerides. Triglycerides are a type of fat in your blood. Think of them like small packets of energy that your body stores after you eat. When you eat more food than your body needs, some of that extra energy is turned into triglycerides and stored in your fat cells. And later, your body can use them for fuel between meals or during an activity. A healthy number should be below 1.7 millimoles per liters. And when your levels of triglycerides go above 1.7 millimoles per liters, it means that the level of insulin in your body has been high. The next type of cholesterol we're going to talk about is the HDL, which means high density lipoprotein. Think of HDL as your body's garbage truck for cholesterol. The job of HDL is to collect excess cholesterol from your blood and bring it back to your liver. Once it gets to the liver, cholesterol can either be recycled or removed from the body. HDL is usually called the good cholesterol because it helps to clean out cholesterol from your arteries and helps to prevent the build-up of what we call plaque. It also helps to balance out the other type of cholesterol called LDL, which we are going to discuss in a few seconds. Without enough HDL, LDL can accumulate in your blood and cause damage. HDL also supports the health of your heart over time, especially as we get older. The ideal level of HDL for women should be above 1.3. There is something we call the triglyceride and HDL ratio. And this ratio is a way to look at your triglyceride and your HDL level together. It is calculated by using your triglyceride levels and dividing it by your HDL levels. And ideally, the ratio should be below 2. A high ratio above 2 means that your triglyceride levels are high and there is more fat in your blood. And it also means that your HDL level is low, which means that there is less of the HDL to clean out excess cholesterol from your blood. And most importantly, when this happens, it often points to insulin resistance, meaning that your body cells are not responding well to insulin. Now let's talk about the third type of cholesterol, LDL, popularly called the bad cholesterol. LDL stands for low density lipoprotein. I want you to think of LDL like a delivery truck for cholesterol, and its job is to carry cholesterol from your liver to your cells. It's quite the opposite of HDL that carries cholesterol from your blood to your liver. LDL works the other way. It carries cholesterol from your liver into your cells, where your body needs it. As we've just discussed, you can already tell that LDL, being called the bad cholesterol, is a myth. The problem isn't LDL itself. The problem is what type of LDL you have and how it behaves in your body. Now, here is the link to what we've been talking about when we talk about weight loss. When insulin is high for long periods, your liver produces triglycerides. Fat burning slows down and your LDL particles change shape. This doesn't happen because you ate too much fat. It happens because of insulin imbalance. Insulin resistance drives unhealthy fat patterns in the blood. LDL comes in different sizes and densities, which affect your risk for heart problems. The first type of LDL we are going to look at is the one called LDL pattern A. It is large and fluffy, meaning that it is less dense, it is big, and it is soft. It moves slowly through your blood vessels and it is less likely to stuck itself to the walls of your arteries. And because of this, it is considered to be the less harmful type of LDL. The second type of LDL is what we call the small dense LDL, which is the pattern B LDL, Pattern B LDL is tiny and compact. It can slip easily into the walls of your artery. It is more likely to be damaged, and because of these characteristics, it is considered more harmful. So the real danger becomes when the small compact pattern B LDL particles become damaged, which is called oxidation. Oxidation happens when LDL is exposed to unhealthy environment such as high blood sugar, chronic stress, smoking, processed oils, for example, soybean oil, corn oil, sunflower, and vegetable oils. Think of it like rust forming on metal. When the LDL particles are damaged, they tend to stick on the walls of your arteries, and this triggers the immune system. Your white blood cells then come in and create inflammation, and these form foam cells, which then pile up to form what we call plaque. And this process is called atherosclerosis, which causes your arteries to slowly narrow, increasing your risk for high blood pressure, heart attack, and stroke. So it is not just high cholesterol that is dangerous. It is small LDL particles in a damaged environment over time. And now, what can we do about this? Here is the truth that nobody is telling you about cholesterol.